Last time we spoke with neurosurgeon Dr. Gerald Schell, we spoke about spinal fusion surgery. Today in the sponsored segment, we talk a little bit more about some potential complications after surgery and what you can do to treat it. We welcome him to the show now. Good morning to you.
Good morning.
Yes, thanks for coming in. What do surgeons mean by maybe failed hardware or failed fusion after a spinal surgery?
Yes, what that means is a failure would mean the patients have a recurrence of their pain to the point where they're not able to do activities of daily living. They're having a hard time moving, getting out of bed. They have to take a lot of medication. So pretty much they're back to square one after a procedure's done. And this sometimes can happen within 6 months to a year to a couple years after.
And what are the most common reasons for that?
Well, one of the most common reasons would be in an elderly patient, the bone softens. It generally takes about 6 months or so for the bone to harden. So during the time that's hardening, the hardware that's put in to hold it in place will then start moving or loosening in the bone. And if it moves in the bone at all, it causes and triggers severe pain.
Sure.
And very common, actually.
Well, and again, I'm sure the symptoms present themselves, but how is this diagnosed?
Well, the CT scan here shows that the screw is surrounded by a dark area and then the bone is lighter. The dark area is simply an area void where the screw is moving within the bone.
And you brought an example of the screws that go in there, right?
Yeah, I thought I would just show you the actual size of these screws. They're quite large. And what happens is in order to immobilize a segment, a screw has to be placed in a bone above and below. And then it's connected with a rod.
Gotcha.
So you can actually see the length of these screws in bone. So after time, what will happen is they'll start moving a little bit in the bone, and the bone has millions of little pain receptors that if there's any motion of those screws at all,
sure,
people feel like they have a knife in their back.
Oh my
with
goodness.
A real stabby pain in their back. And a lot of times people just leave them in. Most docs, a lot of times they say, well, there's nothing you can do, where it's not true. I mean, it's very easy just to take the screws out. And generally what happens is the screws have already done their job, the spine is fused, and then you just need to do a very simple procedure to remove the screws.
You don't need the hardware anymore.
Don't need the hardware anymore.
So folks can come to you and you'll do what?
You just take the screws out. It's a very simple procedure, usually half an hour procedure. Patients go home almost immediately and the stabby pain is gone. So this is it's a very simple procedure that can be done for people who have failures. And a lot of times patients do have failures after these surgeries. Only about 4 out of 5 work. So if you can imagine, 1 out of every 5 patients we do has a failure. That's a significant amount of people, and they need to know that there's ways in which we can help them.
And you can ask those questions directly by going to the website or calling that number that you see there on your screen for Schell Spinal. And thank you, Dr. Schell, for coming in.
Thank you very much.